Hi, everybody. My name is Nadia. Nadia Hussein. I'm a senior campaign manager at Moms Rising, a national advocacy organization for moms and families. And today I'm very excited to be talking about Asian American women and equal pay with our guest, Dr. Drishti Pillai from NAPAF, which is the National Asian Pacific American Women's Forum. So what are we talking about today? What exactly will we be discussing? So we'll discuss why for Asian American equal pay, it's important to disaggregate the numbers when looking at the Asian American community. We'll be focusing on the misleading statistic that AAPI women, which is like Asian American Pacific Islander women, make 85 cents on the dollar that white men earn, and talk about why that is harmful. So our esteemed guest today is Dr. Drishti Pillai. She's a research manager at NAPAF. She was born and raised in India and immigrated to the United States at the age of 18. She combines her academic training in health policy with her lived experiences as a brown immigrant woman to conduct intersectional research focused on immigrant health care experience, maternal and child health, and reproductive justice. Drishti holds a PhD in public policy with a concentration in health policy from George Washington University, an MPH in health policy from Emory University, and a BS in psychology from Ohio State University. Outside of work, you can find Drishti baking, reading, or searching for the best tacos in the area. And she told me that she's in the DMV DC area. So I told her that's quite a search for tacos. So welcome, Drishti. Thank you so much for joining the conversation today.
Thank you so much for having me. Excited to be here.
Can you just share a little bit about NAPAF's work as we begin?
Sure. So NAPAF is the only multi-issue progressive community organizing and policy advocacy organization for Asian American and Pacific Islander women and girls in the United States. Our mission is to build collective power so that all AAPI women and girls can have full agency over our lives, our families, and our communities so that we can truly thrive. And some of our main priority areas include equal pay, immigration reform, reproductive justice.
Thank you so much for sharing. And I will say, especially in light of all that we've seen happening around the country with the Asian American community, I know NAPAF has really been a leader before this, but even now, especially during these difficult times and some of the hate incidents that have been ongoing. So thank you for your work. So let's just jump into it. Drishti, let's discuss the wage gap, what it looks like for different communities, and why is it a concern, and how does it impact the earnings of AAPI women?
Sure. So, the earnings ratio for women in general, as compared to white non-Hispanic men, is shocking. It's for all women, it's about 82 cents to the white non-Hispanic male dollar. And then when we get to communities of color, the difference is even more staggering. Black women earn 63 cents to the white male dollar. Latinas earn 55 cents. Native American women earn 60 cents. And as the aggregated, and as you rightly said, as the misleading statistics suggest, for AAPI women as a whole group, we earn an average of 85 cents to the white male dollar, which is, it sounds better than the other women's groups, but it's still, its aggregated level of 85 cents, it does result in an earnings loss of close to $400,000 over a 40-year career. And this wage gap plays such a large role in not just hindering women's economic agency and autonomy, but also for so many AAPI women who are juggling multiple priorities, taking care of children, family members. The extra burden that is posed by the wage gap makes it very difficult for us to, provide emotional and economic support to our families. We often have to pick between starting a family if we choose to do so, or working a job. Some of us have to work multiple jobs, work long hours just to make ends meet. And, AAPI women uniquely have this double negative effect that we face, which includes the glass ceiling, which is a term commonly used to refer to the barriers to advancement due to gender-based workplace discrimination. But for AAPI women, we also face this bamboo ceiling, which is an advancement barrier that is experienced based on our race and our national origin.
And just could you talk a little bit about, when you talk about disaggregate data, as you mentioned, the 85 cents sounds that, okay, well, maybe it's definitely not as bad as some other black women face, what Latino women face. But can you talk about maybe Burmese women or Nepali women and how the 85 cents is actually paints a very inaccurate picture of what the experience is for a lot of women from Asian countries?
Absolutely. AAPIs, we comprise such a vast and diverse community. It includes 50 different ethnicities, over 100 different languages and dialects. And when we have aggregated data, it hides the true experiences of some of these ethnicities. A lot of times in research, Native Hawaiians, Pacific Islanders, Middle Easterners are just completely ignored. And it perpetuates the model minority myth. And yeah, a great example of this is the 85 cents to the dollar statistic. So this is the aggregated number for all 50 of these AAPI ethnicities, and it seems to suggest that AAPI women are doing fairly well when it comes to equal pay. However, we had a chance to look at disaggregated data for AAPIs over a 5-year time span. And it reveals that so many AAPI women, especially Southeast Asian women, South Asian, Pacific Islander women, the wage gap is so much larger. For example, Burmese women, they earn just 52 cents to the white male dollar. Nepalese women earn 54 cents. Tongan women and Samoan women earn 60 cents. And there are at least a half a dozen ethnicities that fall in this 50 to 60 cent range. And using the 85 cent figure, it completely erases the experiences of some of these other ethnicities within the AAPI community. And it is this false notion that that AAPI women are doing relatively well as compared to other racial ethnic groups. Even though I will say 85 cents is still not equal to a dollar. And what happens is ultimately AAPI women's economic needs are they're ignored during the policy making process because it looks like that there isn't really a problem here. Whereas as the disaggregated data reveal, there are definitely larger wage gaps being experienced by so many in our community.
Absolutely. Thank you for sharing that information. I think even for a lot of Asian Americans, they may not realize that this is such a reality for the very diverse community that AAPI encompasses. My background, my parents' background is from Bangladesh, and when I organize within the Bangladeshi American community, even anecdotally, I know that there are major economic disparities. I know COVID has only made it worse, but I believe on NAPAW's website, for anybody who's watching, NAPAW has a wonderful website. So anything we talk about today, you'll definitely find some of that information on napaw.org. It's 69 cents. So even in that range, it's not the lowest, but it is 69 cents, which is definitely lower than that 85 cents. And it's definitely lower than the equity that we're asking for. And I will say there's so many Bangladeshi American women that are at home all day, but also working in factories, working to support their children. And absolutely, I think that's why it's so important to educate, right? And really spread this information and call on our lawmakers and just policymakers to make a change around that. So
exactly.
I wanted to ask you.
People don't know that a problem. Oh, sorry.
Yeah. No, keep going.
Oh, I was just going to say, if people don't know that a problem exists, then they're not going to put in the resources to try to solve it.
Well, thank you so much. So you touched on the model minority myth a little bit in the last few minutes. So how does the model minority myth impact Asian American communities and promote the misconceptions around earnings and economic outcomes? And how has it been used to promote anti-Black racism and obscure disparities within our diverse communities?
Yeah, that's a great question. Like we discussed, we are not a monolith. Yes, I'm Asian American, but I'm also South Asian American. I'm Indian. And this model minority myth, for the first part, to answer the first part of your question, it falsely assumes that all Asian American and Pacific Islanders have achieved economic and professional success. That stereotype about being doctors and engineers. And due to these, the pervasiveness of these dangerous stereotypes, the lived experiences of a lot of AAPI women are often rendered invisible in conversations around poverty, economic security, wage disparities, even though we form a sizable chunk of the United States workforce. Of the 129 million or so women of working age in the United States, almost 8 million are AAPI. And so this fight for gender and racial justice within our community has to include combating the invisibility that exists within our community. And this, goes back to trying to erase this model minority myth. And then to the second part of your question, which is such an important discussion to have, the fact that the model minority stereotype has created inequality amongst minority communities, and it erases or undermines the struggles of the Black community, the Latinx community, and it also it takes away responsibility from the true cause of these struggles. Like, it disregards centuries of anti-Black racism that is still very much prevalent today. We see it in cases of police brutality, we see it in housing policy, and it's almost like model minority myth has become like this tool that is being dangerously used by oppressors and white supremacists to draw a wedge between the AAPI community and the Black community and other communities of color. And it's used as a very false excuse to justify that, the reason behind economic struggles for a lot of communities of color is not the fact that they are a community of color, and then using AAPIs as an example. Even though we discussed, even within the AAPI community, we are not all thriving. And it takes away the responsibility from oppressors to, comprehensively address the structural and systemic racism that is prevalent in this country. And that is, by all means, the root cause for adverse outcomes that almost any minority community faces. It just minimizes the role that racism plays in all this by trying to pit one minority against another. And it minimizes the experiences of many people within the AAPI community.
Thank you so much for succinctly putting that together, because, in the end, it's white supremacy, right? The white supremacy takes, like you said, what it does is it stops taking responsibility. But white supremacy never takes responsibility for anything. But what you're saying is it takes away racism as actually what the historical cause, the current cause, and puts the onus on, well, you're just not working hard enough. Look at Asian American communities; they can pull themselves up by that bootstrap and just make it, right? And it's a very complicated topic, because, as we know, sometimes the Asian American community can inadvertently support that. You're like, oh, look at us, we are doing well. And I'm not saying, again, that's also not universal, but there can be that element of tension. And my mom always told me this growing up. She said, Nadia, no matter what you do, how well you speak, because my parents, they came as immigrants here. She said, they're not going to see you as white. My mom always told me that. And I was like little, I was like, why are you saying this to me, right? But there's something to be said about that, because even with let's say you are somebody who embraces that model minority myth, that, okay, well, I'm better. It's better for me to be up here than to be wherever else white supremacy is putting me. But in the end, what you see is, you see these hate crimes, right? You see the fact that you don't see diversity at upper levels of leadership and management for Asian men or women, right? Definitely not for women. Then you really see that actually this model minority myth isn't helping anything but white supremacy.
Yeah, and even the anti-Asian hate and racism that has seen such an increase over the pandemic, this has its roots in slavery, in anti-Black racism. It exactly like you said, this is a result of white supremacy. And then to try to say that, no, it's if you just have better social fabric, which is also a myth about AAPI families, then you will succeed. I mean, are you kidding me with the policies that we have in this country, the segregation? Like, are you really, gentrification, are you really telling me that it's none of that? And it's just, it's just, passing the responsibility over to the individual. And then also just, it is so important for minority communities to collectively organize on issues that matter. And this is a big hindrance to that, because there are AAPI families that immigrate here and try to distance themselves from other communities of color, because they, like you said, they fall into this trap of the model minority myth. And I mean, I will admit, I know extended family who have, tried to distance themselves from other communities of color so that, it becomes just us against them thing. And ultimately it's like the divide and rule, super colonial history of white supremacists.
Absolutely. And the thing is, with this history of oppression and white supremacy, there was also a history of collaboration and working together between Black and Asian communities. For example, in I know that there's hidden histories, right? So these are not histories that are talked about in our basic history classes, unfortunately, which are also, that's a whole other topic. But I know that, for example, I have relatives that came in the 1920s, and not just them, but a lot of South Asian men, not women as much, but men came and they married. They married into Black families and Latinx families and raised children because of miscegenation laws, where you couldn't, if you married a white person, or had a child with a white person, that was illegal. And so there were these communities, and there was actually even they would fight for labor rights together, like as a combined group. And then when we have ethnic studies in the United States, that was a direct result of Native American and Latinx and Black communities and Asian American communities working together to lead that charge around ethnic studies. And even I think of Malcolm X, one of his most beloved compatriots was Yuri Kochiyama, of Japanese American heritage. And so I feel like it's also important to realize that there is precedence for us working together as a community, and that there's always going to be forces trying to fracture that, or denying that existence, or history trying to erase that. But I just wanted to uplift that to further highlight what you just brought up, because there is a precedence, and we're only powerful if we can continue that.
Yeah, I completely agree. I mean, NAPOF, so much of our work has been successful only because of our coalition partners, which includes Latinas for Reproductive Justice, and In Our Own Voice, which is the Black Women's Reproductive Justice Organization. So yeah, I completely agree with that.
So I wanted to shift a little bit into what's happening right now with the impacts of the pandemic on the community. So how has the pandemic impacted Asian American women workers and this wage we've been discussing?
The pandemic has been so damaging to the AAPI community in general, especially AAPI women, and as it relates to participation in the workforce and the wage gap. It's just increased economic insecurity in so many ways. One of the ways is through, AAPI women are overrepresented in the frontline workforce. And this includes occupations such as restaurant workers, salon workers, personal care aides. All of these occupations experienced some of the greatest job losses when the pandemic hit. And then AAPI women's immigration status also plays a role in this. So about 7 in 10 AAPI women in the United States are foreign-born. And immigrants also experience some of the greatest job losses during the pandemic. So having that intersectional effect of, being more likely to work in a profession that is more vulnerable to a job loss, like a restaurant or a salon, and then being an immigrant just put us in such a bad spot. The highest rate of job losses during the pandemic have been experienced by immigrant women. You can compare it to immigrant men, white women. Immigrant women have experienced the highest rates of job losses. And since so many of us do identify as immigrants, it really hit us hard. And also, this goes back to what you said about like the increases in hate incidents against the AAPI community. This is also something where, first of all, women face a disproportionately higher burden of these hate incidents. I think the Stop AAPI Hate team had collected data which suggested that women were twice as likely, as AAPI women were twice as likely as AAPI men to be victims of such crimes. And then when you're working in a low-wage job, the Atlanta shootings are a very grim reminder of this, and you're more likely to work in a salon or as a personal care aide. It makes you even more vulnerable to acts of hate, and it further reduces AAPI women's ability to participate in the workforce. I mean, it's not just economic security. If you have to fear for your life, it's really going to discourage workforce participation. Yeah, and it's also important to note down that it's not just job losses that were at an all-time high for AAPI women during the pandemic, but it's also long-term unemployment. AAPI women experience the highest rates of long-term unemployment, and this means being unemployed for longer than 6 months. So almost half of us who lost jobs during the pandemic have been unemployed now for longer than 6 months. And I think this is a very serious issue that needs more just more talking about, more visibility.
When the pandemic was really increasing in last March, March 2020, I was seeing even in my Facebook feed, and just seeing other organizations on the ground that I'm sure NAPAF has partnered with in New York City, some of the bigger cities, of a lot of, as you mentioned, there's a percentage of frontline workers that are Asian American women. They're, doing the domestic worker, who are domestic workers. And in our Bangladeshi American community, similar thing. We do have a lot of domestic workers, and it was just so tragic to see death after death of domestic workers because they could not afford to take that time off to be with their families, and instead they ended up losing their lives to COVID. And I'm just wondering for
Yeah, that's
NAPOF,
so
like
unfortunate.
as the pandemic was happening, is there any stats on that, just about also COVID infection rates and if that's impacted Asian American communities, and if you're a frontline worker during a pandemic, your life is literally on the line. You're risking your life just to be able to make that in unequal pay that you're making.
Right. So we collected some data on just on AAPI women's experiences during the pandemic, and it's broken down by different ethnicities, and it was as high as 20 to 25% of Pacific Islander women, for example, reported that someone they knew lost their lives due to COVID. They lost their jobs due to COVID, or someone in their household lost their jobs. So 1 in 5 women, AAPI women, know someone who has died due to COVID, have lost a job, or have had a member of their household lose a job due to COVID. It's been just so unfortunate. And so many of my colleagues at NAPOF mentioned that they were, and this is just heartbreaking, but they were more afraid of being called the coronavirus than actually getting infected by the coronavirus. Getting on the metro, just the thought that they would be called the coronavirus because they are East Asian or Southeast Asian, that scared them more than actually getting the disease. And if that doesn't speak to how terrible this whole situation is, then I don't know what does.
And it's facing multiple things at one time, right? And I think for a lot of our communities of color, that's been, so many of our communities are facing these disparities and brutalities before COVID, and then during COVID and after. It continues and only unfortunately expands whenever any kind of crisis hits our communities. So I know we talked a lot about some of the issues and some of the data, but let's talk about some solutions. So what are some solutions to the pay gap, and how can people support the movement for equal pay?
Yeah, so that's a great question. There are a lot of general policies that will help reduce both the gender and the racial pay gap. This includes raising the minimum wage. Current minimum wage standards make it difficult for most women of color, including AAPI women, to be financially secure unless we work multiple jobs or work really long hours. And we know that, over the past 40 years, wages have remained stagnant, even though basic living costs have skyrocketed. And these minimum wage policies will have the greatest impact on frontline and essential workers. And as we discussed, this is a population that is disproportionately filled by AAPI women and other women of color. One of the ways is to push your elected officials to work towards raising the minimum wage. Increasing pay transparency is also very important. You won't know if you're being paid fairly if there is no pay transparency. So at an individual level, employers should have honest discussions about compensation with their employees and not punish employees for speaking about their wages. And at a federal level, policies such as the Paycheck Fairness Act help move this cause forward, by the act increases penalties for wage discrimination, and it prohibits retaliation against an employee if they disclose their wage. Um, then finally, expanding benefits such as paid family leave, maternity leave, sick leave, because so many, and this is true for all women. You have to juggle taking care of family members, taking care of your children if you choose to have children, and then a lot of women ultimately, especially in the AAPI community, they are forced. It's a false choice. They're forced to choose between either earning a living wage or taking care of their family. They cannot do both. And we conducted a survey at NAPOF of over 300,500 AAPI women. I think it's the largest national survey ever conducted of AAPI women in the US. And over 70% of the respondents said that they think it's very important that the new administration addresses this, that it works towards expanding benefits that support parents and families, such as sick days, paid sick days, medical leave, maternity leave. I can also speak briefly to some solutions that are specifically tailored for the AAPI community. I've said this a number of times, but I'll say it once again. Disaggregation is just so important. We cannot address the pay gap unless we have full information on how it affects all AA communities. So requiring federal agencies to collect that data and make it publicly available is very important, and it also helps in dispelling the model minority myth. And then immigration reform is also very important. 7 in 10, as I mentioned, AAPI women are immigrants. Many of them come on spousal visas, this H4 spousal visa, which actually does not let you work in the country unless you apply for an employment authorization document, EAD, it's timely, it has its own legal and administrative barriers. I mean, it's kind of unnecessary. Why are you preventing working age women from participating in the workforce simply because they're immigrants? And then finally, just providing more language accessible and culturally tailored job skills services. So many AAPI women that come to America are refugees. They lack the basic resources needed to, participate in the workforce to their full potential. So just making sure that we have services that reach them. If you give us the training and the resources, we will thrive. And also language accessibility. Many Asian households, over 20% of Asian households, Chinese households, Indonesian, Vietnamese, the list goes on, are linguistically isolated in this country, which means that no one in the household over the age of 14 can speak English very well. I mean, you have to find ways to reach this community if you want full participation in the workforce. And yeah, that's really, that's ultimately the main point that I want to drill home, is that AAPIs have been part of the US social fabric for so long. We are the fastest growing racial group in the US. And yet we are constantly ignored, othered, or, just treated like a perpetual foreigner. Asian Americans are more likely than any race to be asked where we are really from or what language we really speak. And equal pay, we cannot make progress towards equal pay unless we take into consideration the challenges that AAPI women face, and just see us and, recognize us for our full selves, our full diverse selves.
Thank you so much for that, Drishti, for all the information you shared today, for sharing the work that NAPOF has been doing for many years, and also sharing some solutions and really pointing to how this is not a siloed issue, right? This is an issue where lifting up our Latinx, our standing up for the rights of Black people to thrive and exist and live in liberation is something that we all need to work on together. And that when we talk about things like disparate pay and we talk about the history of it, that really what's important is for all of us to know as much as possible and to lift each other up as much as possible. So that's why, I'm so excited that both of us were able to be on this Keep It 100 training an event, and I really hope that this has been informative. I hope folks that have been able to join us find this informative. Check out napof.org, check out momsrising.org to find out how, if they're interested in this and want to do more and find out more, there's great information on both of our respective websites. And I hope everybody has a wonderful day, a powerful weekend, and really we just work together to keep changing the world for the better, change our country for the better. Thank you so much.
Yeah, thank you so much. Thank you.